Hi viewers, welcome to my channel Mindcraft. Today we have Dr. Sunita Jagannath with us with her 34 years of rich experience in Ayurveda. She completed her BA MS Ayurveda in 89 and right now she's in Bangalore and she has very rich experience in the areas in which you guys have been asking if there is an alternative treatment apart from you can say the mainstream medicine, Ayurveda and homeopathic. You have been asking me, so she is an expert in this. And uh, let me go to Mrs. Jagannath, if you can give a little light on the specialty in which you are working right now.
Yeah, can I start now?
Yeah.
So actually, I've been in this field for 34 years. So I have seen many challenging problems and all. But nowadays, youngsters, they're having this problem of PCOD. It's very common. Nowadays, I'm getting more than 60 to 70%. 60 to 70% of girls are having this PCOD problem. So, which is very common. The contributing factor here is, mainly is of your lifestyle and food habits, and I can say that. But this problem, PCOD, what we're having, this is one of the main causative factor for infertility. Though it is not the only causative factor, but it is one of the main causative factor for infertility, what we are facing nowadays.
Correct.
So to address this, we need to address this at this point of time, because they are neglecting their health when they are young, and when they turn 30, after 30, they come to me and they say, so we are going to, now we are ready for family way. But when we send them for ultrasound, first thing I send them for ultrasound scan, and we definitely, I know it will be PCOD. So they won't come and tell me, what they have, a irregularity in the periods, and they won't tell me in the beginning. When they come with the report, I normally, generally, I knew it, but still, to support my diagnosis, when they come with the report, it's PCOD only. So then we need to treat that before they need to plan it, right? In hand, we have to treat them before planning. So then it will take again, 6 months to 1 year. So again, it will push them to go for their family way 1 year later. So, and anyway, everybody is aware of it. After 30, the fertility rate goes down. And nowadays, though, it is really because they're concentrating more on career and their education, and there are many things to it. So we cannot pinpoint one reason for that. So it is better, all youngsters, what I mean, they should not ignore their health issues relating to gynecological problem. So when they come around at the age of 34 and all, it's for us, it is a challenging thing to treat them. So though we feel sorry about it, but we need to tell them this is the thing, you have to go through this and all. That is how we are seeing this IVF centers mushrooming everywhere because of the problem. Yeah, you can see that, right?
Yes.
So everywhere. So, and they don't know the problem. Normally, what they do is they just Google it and they come with the diagnosis. Nowadays, youngsters, they'll come and they'll tell me, I have a PCOD. I said, how do you know that? They say, I know that because, I know the symptoms, and also I went for routine checkup and I found this and all, this.
Correct.
They talk as though it is very common, they no need to address this, which is the thing, problem and challenging problem for doctors to treat them, because they think they know everything, but it is not so. It is not so. So when they come with this PCOD report, and when they come to me, when they are ready to go for the family way. So it should not be like that, like when they are at the age of 23, 24, if there is any problem with their monthly flow and all, so they have to go and see a gynecologist. If it is required, they will ask you to go for ultrasound scan and do it. There is nothing wrong in going for it, right?
Medical checkup should be done.
Yeah, should be done. Should be done, because there is very common thing nowadays we are facing. It's better. So it should be done when you are ready for the marriage. What I feel, you should go for it. So when you are going to have a baby, it's a secondary thing. But yes, if you are going for a marriage thing, then definitely you need to have baby later on. So better to know about your health issues in advance so that it can be addressed easily. That is one of the thing. So when they come with the PCOD report and all, they say, see, ma'am, I have this PCOD, so what to be done and all. So they go to a gynecologist and they take treatment, because in modern science, they treat with hormonal thing. So that is the only answer what they have. So, and they will advise you to go for, lifestyle changes, modification and all, but which youngsters, they don't follow it. And we are all very aware of it. They need actually counseling for PCOD. What I feel, what I do is, before treating them, I give 2 sessions of counseling, and I will try them to understand what is PCOD, what is the problem, because it is not a pathological cyst. It's a functional cyst. It comes and goes. It's a cluster of cysts which inhibits the ovulation. That is the only thing. So it is not necessary this month they have this PCOD and after a few months it will be there permanently. It is not so. So, but we cannot go for each and every month for ultrasound scan, right? So once it is there, PCOD means you are tend to get cyst during the ovulation. So better to manage this, and it is easy to manage this, because what I advise them is, they have to change their lifestyle. They have to make their modification in the lifestyle. They have to go for exercises. Why exercise is very important in this PCOD cases? Because the male gland which controls the hormone and the ovulation is pituitary gland, which is situated in the brain. So to stimulate that brain, you need to have rigorous exercises. So once you found you have this PCOD problem, better you adopt certain exercise regimen in your daily routine, so that definitely you can manage this with this. And next part comes food habits. Nowadays everybody is I don't know. They have changed their lifestyle and food habits. And ek din chalta hai type. One day they have the spicy food, and there is no regular regimen what they have this daily routine food. So that needs to be corrected. The third one is, yes, if it is required, we have to give medication to manage this PCOD. That doctor will decide, not the patient, whether it is required or not. So this is why this is the 3 things I adopt. So first thing, exercise, and second thing is they have to change their lifestyle regimen, and third is this medication, if it is required, the doctor will take care of it.
Correct. And one more thing, Dr. Jagannath, I would like to address here, because when I meet my clients or my candidates whom I'm training, you will not believe, in the age group of 20 to 30, migraine is so common. And when I check with them, it is about the thought process, right? So it is again a lifestyle change. But candidates who are getting 4 times, 5 times migraine in a week, I think they have crossed the borderline. Even lifestyle change is not helping them. So definitely, if there is an alternative again in Ayurveda, instead of taking those heavy medicines every now and then and coping up with their exams or coping up with their profession, we can also take Ayurveda, in which they can have the relief and no side effects. That is the main thing.
Sure. This migraine is one thing, we don't call it as migraine in Ayurveda. So we have Shirashula, we use only Sanskrit terminology for all these things. So we call it as Shirashula. There are 20 varieties of Shirashula is there. Actually, it is not one migraine or neurological. No, it is not like that. So we can correlate this migraine into Pittaja Shirashula. Okay. So if it is related to Pittaja Shirashula, we need to examine a patient. So what are the symptoms associated with headache, what they have, and the time of the headache they get, and is it related to food, or is it related to their sleeping pattern, or is it related to their lifestyle? So we need to know about all these things to come to the conclusion whether it is a migraine or different types of Shirashula. This is how this is the special feature of Ayurvedic we do in a different style of diagnosis.
Correct.
Okay, so then first we have to do the diagnosis, whether it is migraine or different types of headache. Depending upon that, we treat them through medicine and their lifestyle and yoga for that matter. So I do have yoga experts, therapeutic yoga experts. So normally what I do is I connect them
To those
through,
experts.
like this one, and they go through, they go through that exercises, yogic exercises, which is causing, the problem for headache and all. So only those asanas they have to be taught there, and they practice those asanas along with the medication and little changes in the lifestyle. Definitely, they can beat my Shirashula. I don't call it as migraine because migraine is one type of Shirashula. Any type of Shirashula, then we can manage beautifully. And the third
such a
very
beautiful term.
important
I
thing
should
here
say
is,
such a beautiful term for migraine, actually, you said. Such a
yeah, that's what, that is one thing. Yeah, and there are many cases, youngsters, they come up, the complaint of Shirashula. Then we call them, okay, Shirashula, don't worry. So I send them for eye checkup because normally they do have this refractive errors. If that is the positive factor, we need to correct it there because they think there's a migraine. So they just come up. That's what I said. Nowadays they come up with the diagnosis. So you need to tell them whether it is. So we have to correct them whether it is right or wrong. The very funny thing I'm facing now, another since 5-6 years, they come up with the diagnosis. So earlier it never used to be like that. They used to come with the problems, and we used to
and the diagnosis.
we used to diagnose. So nowadays it has changed. It has changed now. So then again, it is related to stress-related headache, what we call it, stress-induced headache. So that is a management is completely different. We do Shirobasti, Shirodhara, Panchakarma treatment we adopt. Along with that, little bit of medication and pranayama, yoga. They have to do pranayama and all. They will get rid of this. And a little bit of counseling I do, because if it is stress related, yes, we need to do counseling about, So then they feel good about it and they come up with, oh, I'm good. And you will not believe, in certain cases, I don't write any prescription. I just speak to them and I teach certain asanas and I tell them, you have to be, where they are doing mistake and all in food part of it. I explain to them, and only with those things they will come up with, like, ma'am, I'm okay, I'm fine now. I feel good about it. Without medication, if they can manage, what else you want, right?
Correct. Dr. Sunita, that same aspect even I'm taking care of when I'm doing counseling, apart from my training. What I see, this talking therapy, then you have dialectical therapies where we'll teach them life skills. Similarly, I think in Ayurveda, apart from the medication, what kind of counseling you're doing, it is going to really give us very good results, and we should go for checkup. And actually youngsters they think they are young, so it's not their fault actually. So this is the reason I brought you up to the channel, so that we can give awareness. And not only candidates from Bangalore, even outstation can connect to you on video calls. They can connect to you on audio calls, and consultation can be done. So I'll share the link below. I'll share the link, your phone number and your address of the clinic, where they can directly consult. They'll directly come.
I will do that because I started doing this during COVID time, I started doing online because of, it was a very bad phase for doctors and patients during that time. Because normally I don't do general practice. I do, selected cases and, challenging cases I take up. So for them, to connect them, it was a tough time for us during COVID time. So I started this video call, and it went on very smoothly and all. So that's how it should be actually.
Not only outside, even in Bangalore, I've seen many of my clients, they prefer that, ma'am, can we go online counseling instead of traveling and wasting time? Because you know how Bangalore has become now, so traveling has become a challenge. So that is also very good, and I think they can consult.
So I don't know what to say about this, because people there, for them, everything, it should be like that. Within a minute it should be available, and that is also one of the reasons they don't want to go this one. But it's okay. But when you talk in person, effect is something different. Physical. This one is completely different. But only in emergency, if it is not possible, and traffic is not the only thing you
Reason,
can,
yeah.
avoid physical. No. I don't think, because
Correct,
like
correct.
I know I travel a lot, I drive a lot, so I don't think that is the factor we should not consider it. So if
Correct.
you want, yes, you should go for it. Yeah.
Yeah, they will do that.
And when you are talking about counseling, you said, like, yes, it's very much required nowadays. Like everybody thinks India we don't have mental health issues, but I'm very sorry to say that we are more into,
Yeah,
health issues, mental health issues
mental health.
than Western countries now, because they talk about it. In
Yeah,
India, we don't talk.
we don't talk.
So I'm okay. And like when it comes to that level, they come to us, and for us, it is difficult to manage it.
True.
But that awareness is very much required, and you are doing a wonderful job, Abhilasha. I'm really happy for that.
Thank you so much. Thank you so much. So this awareness, what we are spreading, I think you have helped me a lot with this. And I'm really, really humbled by your presence and giving time to my candidates and my viewers and subscribers.
Sure.
Thank you so much. And rest, whatever now candidates want, you can directly connect to Mrs. Jagannath. And I'm sharing her number and the details of the clinic. Thank you so much. Thank you so much for taking our time.
Okay. Okay, Abhilasha, thank you so much.
Okay.
Thank you so much once again.
Okay,
Bye.
have a good day. Have a good day.